Hello guys, so now we shall be discussing completely about the scalp. Okay, so we shall discuss what are the different kinds of layers we have in the scalp. Okay, so the mnemonic also goes the same way, that every layer has got each layer. For example, if you look the outermost layer of the scalp, okay, so this is the scalp basically. So in the scalp, if you look, see, for example, let us say for example that this is a picture from the back, for example. Okay, for example, just think that this is a picture from the back side. Okay, now what I am doing is that, see, this is your scalp, isn't it? This is your scalp, right? So what I will do is that I will just cut a part of scalp and then show it to you here. So this is the outermost layer where you see the hair follicles over here, right? So this is the outermost layer which contains skin, yes or no? So let us see what are the layers is it having completely. So first important thing is that the outermost layer, whatever you can see, is containing skin plus connective tissue. What kind of connective tissue? It is having dense connective tissue. It is having dense connective tissue. Dense connective tissue. Okay, next, after that, you see the next layer over here, right? So this second layer, whatever is there here, is called as aponeurosis. This is also called as epicranial aponeurosis. Epicranial aponeurosis. Epicranial aponeurosis. After that, this particular layer which you can see over here is called as loose areolar connective tissue. Loose areolar connective tissue. Okay, and next, this layer over here which you can see is called as your periosteum. Periosteum. Okay, so what are the different kinds of layers which you can see? So all of you just concentrate on the first letter over here. You see, this is S, C, right? What is S and C consisting of? Skin plus dense connective tissue. Next, here A. What is A over here? A is nothing but your, you see this A over here, A is nothing but your aponeurosis. And after that, SCAL, L stands for what? Loose areolar connective tissue, and P stands for what? Periosteum. So the mnemonic goes in this way: SCALP. S and C stands for skin and subcutaneous tissue. A stands for here aponeurosis, epicranial aponeurosis. The next layer is loose areolar connective tissue, and P here stands for periosteum. Okay, so these are the layers of the scalp. Now the first layer, if you look, that is your skin and the dense connective tissue. If you look at the skin and the dense connective tissue part, what is the skin and the dense connective tissue consisting of? Obviously, you know that it is consisting of hair. Not only hair, it is also consisting of sebaceous glands, right? If sebaceous glands are present, then can I tell that sebaceous cysts are most commonly formed in the skin region, right? So skin is consisting of hair follicles as well as sebaceous glands. Okay, so when I tell sebaceous glands, it means that sebaceous glands have a tendency, once if the gland is let us say if the gland is clogged, okay, or if the gland is obstructed, so obviously there a cyst will be formed, that is called as sebaceous cyst. Sebaceous cyst. Okay, so this is all about the skin and the dense connective tissue. The next important thing is what? The next important thing you have got over here is your epicranial aponeurosis. So the next important thing is your epicranial aponeurosis, right? So what is this epicranial aponeurosis over here? If you look at this picture, you will understand. See, in this picture, you see this part of the muscle which is located in the forehead region, in the frontal region, right? So this muscle over here is called as frontalis. The name of the muscle is frontalis. Okay, in the same way, you can also see the muscle that is located on the back. So this is called as occipitalis. See, these are the muscles of the scalp. One is called as frontalis. See, this one is called as your frontalis, and this one over here is called as your occipitalis. Now connecting frontalis and occipitalis, you see this connective tissue all over, right? All the way from the frontal region to the occipital region, you have got a connective tissue like this, right? So this connective tissue, whatever is there here, is what is called as your epicranial aponeurosis, right? So this connective tissue is nothing but called epicranial aponeurosis. Okay, epicranial aponeurosis. Now after this epicranial aponeurosis, the next layer we have got is a loose areolar connective tissue. Now one very important thing you need to remember regarding this loose areolar connective tissue. So this loose areolar connective tissue is also called as a danger area of the scalp. Okay, this is also called as the danger area of the scalp. Why this area is called as a danger area of the scalp? The reason is that within this area, for example, just look at this picture over here, you will understand. So in this picture, you see on the surface of the scalp here there is some vein. Okay, and inside the brain tissue, you see this is your cerebral hemisphere, this is your cerebral hemisphere. Dividing both the cerebral hemispheres, from my previous lecture of anterior cranial fossa, there I have talked, dividing both the cerebral hemispheres, you see this part in between, this is called as flax cerebri. Flax cerebri. Okay, next important thing, just above the flax cerebri, you see this sinus over here, right? First of all, how flax cerebri is formed over here? See, this flax cerebri is nothing but, dura matter in the brain, right? Dura matter in the cranial cavity, it is double layered. Okay, so basically this is how your dura matter is. See, this is the outer layer of the dura matter and this is the inner layer of the dura matter. So what is the outer layer doing? Outside you have got your scalp. This is your skull bone, right? So outer layer of dura mater is closely attached to the skull bone. That is why this is called as endosteal layer of your dura mater. Why? Because it is attached to the inner lining of the scalp. And the next layer of the dura mater is called as meningeal layer. Why? Because this meningeal layer is closely attached to the surface of the brain. So this is your brain, let us say, right? So here there are two layers. See, this particular layer is called as endosteal layer of your dura mater, and this is called as a meningeal layer of your dura mater. So in the cranial cavity, dura mater is of two layers. So which is lining your skull cap, that is called as your endosteal layer, and next which is lining the surface of the brain is called meningeal layer. So these are the two layers of your dura mater. But at some places what will happen is that this is what happens. See, for example, you see this particular layer, this is called as your endosteal layer, right? Now at some places what will happen is that the meningeal layer separates from the endosteal layer in this way, and again it continues back. So this gap, whatever you can see, right, this gap where the endosteal layer and the meningeal layer are separated, this gap is nothing but called as dural venous sinus. So if you can look here, you see this sinus over here, you see this particular sinus is dural venous sinus, and connecting the veins which are located externally to this dural venous sinus, you see these small veins which are connecting like this, right? These veins are called as emissary veins. And actually, if you ask me a question, where are these emissary veins present? These emissary veins are present in the loose areolar connective tissue. Okay, so why it is called danger area of scalp is that, for example, if you got any infection to the scalp, so if you look at this picture, if you got any infection to the scalp, that infection will enter into this vein, right? The vein which is located externally, and from this vein, this infection will enter through this emissary veins, and these emissary veins in between as a bridge, what they do, they send the infection from the veins externally directly into your dural venous sinus, and from here the infection can very easily spread to the surface of the to your brain. Okay, so can I tell emissary veins are bridging veins. So why emissary veins are very dangerous? This is the reason why emissary veins are dangerous, because the infection from outside can easily be sent inside into your brain dural venous sinuses with the help of these emissary veins. Okay, that is why you call this as the danger area of your scalp. Now in the scalp, let us look at the arterial supply of the scalp. Okay, arterial supply, at the same time we shall also look at the nerve innervation. Okay, so first of all, let me draw the scalp from the top surface. For example, let us say that these are the ears, and let us say that this is the nose. Okay, so what I will be doing is that I will divide this scalp into two parts. All of you know this is the frontal region, this is the occipital region, the back. I'll be dividing the scalp into two parts. On one side I will explain the arteries, on the other side I will explain the nerve innervation, right? So first important thing is that on the scalp here you got an artery here. Okay, the same artery will also be present on the opposite side. Okay, so okay, let us draw arteries first and then nerves later. Okay, so these two arteries, right, what are these two arteries here? These two arteries are called as supratrochlear artery. Okay, so what are these two arteries? Let us write it as artery number 1. Artery number 1 is your supratrochlear artery. Okay, next, just side to supratrochlear artery, you see another artery that is coming up. So this artery is coming above the eyeball, from above the eyeball. See, this is an, for example, let us say, you see here, let us say there is one artery that is coming all the way like this. You call this a supratrochlear. Now above the eyeball there is one artery that is coming here. So anything coming above the eyeball is called supraorbital. Okay, so this one over here is your supraorbital. So artery number 2 is your supraorbital artery. Now after this supraorbital artery, next, all of you know this is your temporal region. Now in the temporal region here, if you see an artery in the temporal region, this will be artery number 3, that is called as temporal artery. Okay, now after this temporal artery you see another artery, but this artery this time is present behind the ear. Any artery that is present behind the ear, number 4, behind the ear is posterior auricular. So this artery is called as posterior auricular, behind the ear artery, posterior auricular artery. Okay, and the last artery that is present on the back here, you see, it is present on the back. So this surface over here is called as occipital area. So the artery is occipital artery. So what are the different kinds of arteries you can see over here? One is called as a supratrochlear artery, next is called as a supraorbital artery, third is called as a temporal artery, fourth is called as a posterior auricular artery, and fifth is called as a occipital artery. So these are the arteries that are supplying to your scalp. These are the arteries that are supplying to the scalp. Now let us look at what are the nerves that are innervating the scalp. Okay, so let us look at the nerves that are innervating the scalp. This is the nose, and yeah, now coming to the nerves, what are the different kinds of nerves? So if you have here the artery, the first artery which we have written over here is supratrochlear. So obviously the nerve also here will be supratrochlear nerve. So nerve number 1, that would be supratrochlear nerve. Supratrochlear nerve. Okay, next, after supratrochlear, the second one over here, we have written it as supraorbital. So why? Because it is above the orbit. See, here also you have got the second nerve over here, and this nerve number 2 is called as supraorbital nerve. supraorbital nerve, right? The next nerve, now coming to the next nerve, see, one nerve is supratrochlear, next just above the eyeball, that is supraorbital, right? Now there is another nerve that is passing like this. So now what will you name it? If there is a nerve that is passing like this onto the scalp, see, it is first it is crossing the zygomatic bone, then it is crossing the temporal bone, and then it is coming onto the top. So you have to call it as zygomatico-temporal nerve. So the name of the nerve is zygomatico-temporal nerve. So here you have got that nerve like this, right, on both the sides. So this nerve number 3 is called as zygomatico-temporal nerve. Zygomatico-temporal nerve. Next important nerve. After that, where is your ear? See, here there is a nerve that is passing like this, I told you, right? So exactly from here there is a nerve passing above the zygomatic bone, above the temporal bone, and supplying here. So this nerve is called zygomatico-temporal nerve. Now just behind this is your ear, right? But still this is your temporal bone. So above the ear, this is your ear canal, right? So above the ear an artery is passing, and then it crosses the temporal bone, and again it goes back like this. So what is this artery called as? First it is crossing the ear, so you call it as auriculo. It is crossing the temporal region, so temporal. Then this is nerve. So auriculotemporal nerve. Okay. So this nerve is called as auriculotemporal nerve. So this is the nerve over here. Okay. Nerve number 4. Nerve number 4, that is your auriculotemporal nerve. Okay. Next important nerve. Next important nerve is that there is a nerve that is passing just above the ear, and this nerve is very long. There is a nerve just passing beside that, right? But this nerve is short. So what is nerve number 5 and nerve number 6? Nerve number 5 and 6, they both of them are passing from the ear. One is long, one is short. The one which is very long is called as greater auricular nerve. This is called as greater auricular nerve. Nerve number 6 is lesser auricular nerve. Lesser auricular. Okay. In the same way, next you see a nerve that is coming all the way like this. Here also you see a nerve that is in the occipital region. Just near to that you see a next nerve in the occipital region which is longer than this. You see, in the occipital region only, longer than this nerve. So this nerve is 7 and 8. What is 7 and 8? Out of 7 and 8, which is short? 7 is short. So lesser, and it is present where? In the occipital region. So occipital nerve. Obviously then 8 will be greater. Greater occipital nerve. Greater occipital nerve. Next important thing is that there is only one nerve that is left, that is present on the back here, right? So this nerve which is present on the back here is called as a third occipital nerve. So first occipital nerve was lesser, second occipital nerve was greater, and there is only one occipital nerve, right? So there is no comparison with the sizes here. There is only one occipital nerve that you called as a third occipital nerve. Third occipital nerve. So this is number 9, third occipital nerve. So what are the different nerves we have got? The first important thing, supratrochlear, right? Supratrochlear as well as supraorbital is common for the arteries and the nerves. Next, if the nerve is passing above, right? Again, if the nerve is passing above the zygomatic bone and above the temporal bones, you call it as zygomatico-temporal nerve. If it is passing above the auricle, above the ear and above the temporal bone, it is called as auriculotemporal. And remaining all are just comparison. One nerve on the ear is small, so lesser auricular is large, greater auricular. In the occipital region, one nerve is small, lesser occipital, greater, another one is greater occipital. And there is no comparison of the sizes. The last one solo is called as third occipital. So this is the nerve innervation which you basically see. Okay. So what are the things we have just discussed, guys? we discussed that in the scalp region, okay, we have got layers. S and C stands for skin and dense connective tissues. Next, A stands for aponeurosis. What is this epicranial aponeurosis? It connects the frontalis with the occipitalis. Next, L stands for the loose areolar connective tissue and P stands for the periosteum. Next, coming to the skin and the dense connective tissue, we have got what? Hair follicles and sebaceous glands. Okay, sebaceous glands will have sebaceous cyst, right? So they can develop sebaceous cyst. And loose areolar connective tissue is very important. Loose areolar connective tissue is called as a danger area of the scalp. Why? Because it has got what veins? Emissary veins, which are also called as bridging veins. So what does it do? Infection from outside very easily, directly it can throw into the dural venous sinus with the help of these emissary veins. So arteries, just now we discussed. Veins, just nerves we have just discussed. So this is the innervation. Innervation we have discussed. So this is all you need to know regarding the scalp region, guys. So thank you so much for watching my video. Goodbye.